Have you ever wondered why, despite being so exhausted, despite being so tired, you can't fall asleep at night? Assalamu alaikum wa rahmatullahi wa barakatuh. Today, we dive into insomnia. I'm joined by Dr. Omar Shariff, a psychiatric registrar at the University of Nairobi. Daktari, assalamu alaikum wa rahmatullahi wa barakatuh, and feel most welcome.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you so much.
To take it off, I would like us to go directly to insomnia. You tell us what insomnia means by defining it. Insomnia
is having poor sleep quantity or quality with the complaints of difficulty in initiating sleep, or if not difficulty in initiating sleep, having not enough sleep. So what we basically mean in insomnia is that you can sleep, but you don't feel like you have restored yourself. You don't feel the energy of waking up the next morning.
Maybe what are the causes of insomnia?
So the causes of insomnia are many. First, before we even talk about the causes of insomnia, insomnia is part of sleep disorders, which are a number of them. But if we talk about insomnia on its own, the diagnosis of insomnia has to have 6 main components. The first one is there is that poor sleep quality or quantity of the sleep, either difficulty in initiating the sleep, difficulty in maintaining the sleep, or difficulty or early morning awakening, or meaning that you cannot sleep through the whole night. Second of all, there must be a significant disturbance in the occupational, educational, academic, behavioral areas of functioning. The other thing is that the sleep difficulty should occur 3 times in a week for the past 3 months. The sleep difficulty also happens even though you have opportunity to have a good quality sleep, okay? And it should also not be consistent with things that are other medical conditions. For example, having pain or having any other chronic diseases. When we talk about causes of insomnia, the first and most important cause of insomnia is any emotional disturbance, either being angry or being lonely or going through grief, or even having any other emotional disturbance. That is the main cause. The second one is any psychological cause, things like stress, depression, post-traumatic stress disorder as one of them. These ones are usually the other common causes of insomnia. After that, you go to medical causes of insomnia, things like, for example, having chronic lower back pain, having any psychological issues such as bipolar mood disorder, schizophrenia, and so on. So these are usually the most common causes of insomnia. The other causes of insomnia are poor sleeping hygiene, such as using electronics before bed, having an improper pattern of sleep, and so on.
Maybe what are most common lifestyle habits that may cause insomnia?
Yes, the most common lifestyle habit that causes insomnia in our current generation is usually our mobile phones. Okay. Mobile phones, TV, electronics in general. So someone comes and wants to sleep, but before they go to sleep, they are busy on their phone. The blue light from the phone itself, according to research, causes your body to start becoming awakening again. It starts to become awake. So automatically this will cause insomnia.
Okay.
Having a non-specific sleep routine. Today you sleep at 9, tomorrow you sleep at 11, the other day you sleep at 12. That one automatically will cause you to have insomnia. Number 3 is the diet you take. If you take coffee, especially caffeine drinks, before bed, automatically you will have difficulty in initiating sleep.
Now, what should we do to run away from this serious defect that is affecting so very many people? You find someone is very tired, he's at home, he gets home very tired, but he can't just fall asleep. He stays on phone throughout the night, what should we do as patients or those people who may be facing this serious defect?
Well, basically, the first and most important thing in management of insomnia is having a very good sleep hygiene. And sleep hygiene basically starts with, number one, having a routine, bedtime routine. If you're usually used to sleeping at 10 o'clock, you sleep at 10 o'clock. Number two, in terms of sleeping hygiene, is keeping the bedroom cool and dark. You need a dark environment. Number three, you should not have sleeping episodes during the day. Napping during the day should be avoided completely. Number four, no stimulants. Caffeine should be avoided before bed, at least 3-4 hours before bed. Electronics before bed should be avoided completely. You're not supposed to watch television, use your phone or even computer 1 hour before bed. The other thing is having a bedtime routine, which is very important, so that you automatically know that, oh, I'm going to do this, I'm going to do this. The other very important thing is winding down. Making sure you are winding down at least 1 hour before bed, avoiding stimulating activities, so that you cannot be emotionally alert. So you're not supposed to go for a meeting and then you go to bed. No. Or you attend a class and then you go to bed. No. If it's 1 hour before bed, you make sure you have wind up completely. And then the other thing is the environment. You should make sure that your bed is only for sleep, for nothing else. And then number four, do not get anxious when you don't get to sleep easily. So the anxiety of not being able to sleep, like looking at your watch and so on, this automatically will lead to more insomnia. And then that is in terms of sleep hygiene. The second thing you can do if you're having insomnia is now to seek medical assistance. If it has passed 3 months and you still don't have sleep, you can seek medical assistance. And the first thing they usually do is psychotherapy, something we call cognitive behavioral therapy, specifically for insomnia. If that does not help, for between 6 to 8 weeks of seeking therapy does not help, now is when we start considering hypnotics, drugs that can be used to help you sleep.
Maybe you talked about anxiety, stress, and so very many causes of insomnia. How can someone address insomnia that is associated with either anxiety or it is associated with stress? How can we address it?
Insomnia that is associated with emotional conditions, such as number one, things like, for example, you have mentioned anxiety. For anxiety, the best thing to do is to journal down whatever is troubling you. Whatever you're anxious about, you have to write it down. You have to give yourself time to think about exactly what is making you anxious and how can you overcome that anxiety. For things like anger, if you're angry at someone or you have had a confrontation with someone, it is important for you to address that issue before you go to sleep. So you try and talk to this person and reason out with this person. Because if you go to bed angry, automatically it's very difficult for you to initiate sleep and you will have insomnia. For things like grief, for example, if you're going through something that you're grieving and so on, it is important you address that grief. If you are lonely and that you don't have someone to talk to and so on and so forth, you have to also address that by having friends over or talking to family and so on, engaging people in a social setting or a social gathering that will help with also your sleep.
Daktari, I'm asking myself so very many questions. Can insomnia cause any psychological illness?
Yes. Persistent insomnia can cause a lot of other illnesses. Persistent insomnia can cause illnesses such as a common one that we usually see around anxiety disorders. Anxiety disorders whereby the person is anxious all through the day. Number two, it can also cause depression, something we call major depressive disorder. How this happens with major depressive disorder, it is whereby the patient, because they have lack of sleep, they can no longer perform at work. They can no longer function at school. So they lag behind in school or in work, and they fall into depression. That is the other condition, psychological condition that insomnia can cause are now psychotic disorders. Things, for example, like schizophrenia, schizoaffective, and so on, whereby now someone develops hallucinations and delusions. And then finally, it can also cause mood disorders, because lack of sleep causes irritability. It causes aggressiveness. So the person becomes irritable, aggressive, leading to other mental health illness like bipolar mood disorder. Yes.
You did say that people should avoid using either coffee or any other substance while going to bed. But I'm having another very hard question that I'm asking myself. There is those people who cannot sleep without using either tea leaves, coffee, or any other substance, especially which are related to nicotine. So my question is now, you've gone to work, you didn't take tea throughout the day, you come in the evening, you're feeling a very serious headache, you decide to take coffee. Is it likely to affect your sleep system? Is it likely to affect your brain? Is it likely to affect your sleeping hygiene?
Okay, this as much as this the stimulants you're mentioning, caffeine and nicotine and so on, other than them being stimulants, they are also highly addictive. So the cause of the headache is because you are addicted to, for example, the tea or the caffeine. Now, what we are saying necessarily, we are not saying you stop taking the caffeine completely. Okay. But what we are saying is the intake before bed should be avoided. If you are going to sleep at around 10 o'clock, at least 3 hours, 2 hours before bed, you should not take any caffeine.
Okay.
Yes. By that time you're going to sleep, automatically the caffeine level would have reduced in your body. Okay. It would not have been the same like before. So it's very important for us to understand that we are not saying, yes, you stop taking tea or stop taking coffee, but before bed should be avoided, and it's highly discouraged.
Okay.
Yes.
How is brain related to sleep? Like when you're going to when you take food in bed, you are likely to be affected or get insomnia. When you use your gadgets, these are phones, televisions in your bed, you are likely to influence your brain from getting insomnia. How is brain related, or how does these two things work between your sleep, your sleeping hygiene, your so very many things? How is it related with insomnia? So
when human beings are basically all about habits, and we interrelate things based on what we associate that thing for us. For example, automatically when we see a car, we automatically know this is for moving from point 1 to point 2. Watch is for telling us time. Home is for relaxing. Your phone is for distraction or communication. So we relate things to what purpose they serve in our life. And it's all part of our habit. The same way that you hear adhan and you know it's time for prayers, it's the same way that you enter the masjid and you know this is a place for prayer. It's the same thing when it comes to your room, that you know room is specifically for sleep. If you do other activities in that room, it becomes very difficult for the brain to differentiate between what am I supposed to do here at this specific time. So it's going to be about forcing yourself to sleep. But if the brain has been trained, if you train your brain to know that every time I'm in my room, it's specifically for me to sleep, then automatically you enter that room, you will fall asleep. So it's all about training a specific area for a specific function. Yes.
Is there any common misconception about insomnia?
Yes, one common misconception is whereby people say if you exercise, it will be difficult to fall asleep, which is false. It depends. If you are in pain, automatically you'll have a hard time falling asleep because of the pain. But if you exercise and you're physically not in pain, it actually helps you to fall asleep faster. because there's something we call the dopamine rush after exercise. It is called runner's high, whereby the dopamine level increases significantly high after you exercise. And this one will help you with sleep. So that is one of the misconceptions. It's good for you to exercise before bed. I personally do it, and it really helps me it helps me initiate sleep and sleep even better. Mm-hmm. Yeah.
Now, I think I'm approaching to the end, but I cannot finish this interview without asking this question. You find there is those students who study throughout the night. So when it comes to during the day when they are in class, you see them counting. We used to say counting plots, nodding and nodding and nodding. Now, how do we differentiate between insomnia and this defect? Maybe is it also a defect because you did not sleep at night because you are studying, but during the day you find yourself feeling very hard for you to do your daily activities because you're feeling like you cannot do it. You have a lot of sleep.
So first and foremost, what I would advise such students, studying through the whole night is not a good idea. It's better you go to bed early at around 8 o'clock, 9 o'clock, and you wake up at 3 or 4. When you wake up at that time, your brain is so fresh, and it will be easier for you to study.
Okay.
And this will not even affect your daytime, your daytime activities, because you have rested enough. So that is the first thing they should do. Second thing that they should consider and do is that, yes, you have a deadline for something to do. You want to finish it through the night and so on. This is not going to be a productive time for you, because your brain wants to sleep. Your brain wants to recharge. Your brain wants to restore itself. Sleep is the most essential thing. You can do away with food and drink for almost a week, but just missing 2 days of sleep or even 1 day of sleep, you become abnormal.
Okay.
You become abnormal. One of the critical symptoms we usually try to get from a patient whenever we are making a mental health diagnosis is lack of sleep. Someone tells you this person does not sleep. He stays up the whole night doing singing or cleaning the house or just moving around and so on. So that shows how essential sleep is to the brain. It's the only time the brain consolidates all the information, stores the information, makes memories. It cleanses itself out of, because during the whole day you are very much stimulated with different things. It cleanses the toxins from the day, because you remember you have to understand that the environment we are living right now, there are a lot of free radicals coming from our phones, coming from the food we eat, and this can affect the body. Our immune system works at that specific time to prevent things like cancers of the brain and so on, because it starts killing those cells that are becoming mutated. Okay? So if you miss out on this, and then emotional regulation usually happens at night. So if you miss out on sleep because you are trying to finish a project or something of the sort, your functionality and the quality of the project will be very poor. Okay? So the best thing for them to do is, even if you have a deadline, you sleep early, you wake up very early. You wake up very early, like at around 4 o'clock, even 5 o'clock, and you finish your project. But if you see that during the day, the body, because it wants sleep so much, it will try to compensate by you having these episodes of sleeping during the day. As you are saying, the nodding and so on, the napping and so on, the yawning and so on. All this happens because the body is trying to tell you that I really need to sleep. Okay. Yes.
Is there any other importance of getting enough sleep?
Another very importance of getting sleep is it also helps with your ideas.
Okay.
There is a very nice philosopher by the name Immanuel Kant. He's a philosopher. He came up with a philosophy on utilitarianism and so on. Immanuel Kant used to go and visit his friend at 2 o'clock. He comes and he finds his friend sleeping at 2. So even him, he does not want to wake his friend up. So he sits, and then even he falls asleep. Another friend, another philosopher comes, sees they are both sleeping, he joins them and sleep. Out of nowhere, they all wake up at 5 o'clock and they start their discussion on philosophy. Because how does it happen? It's because they have rested their brain. Their ideas have become consolidated, and automatically now they have better ideas. So another advantage, it helps with you coming up with better ideas. The better your sleep quality, the better your functionality of your brain.
Thank you so much. You really elaborated almost everything, but now, before I let you go, I want you to give our viewers your general advice. What may be your general advice?
General advice when it comes to sleep is as important as the food you eat. Sleep is as important as anything else you do in life. Without having a proper sleep schedule, you will, even in the long run, you will suffer. You will get diseases that are physiological, like hypertension, diabetes, and so on. So having a good sleep hygiene should be priority. You should always have a specific routine, bedtime routine. If it's immediately after Isha, you go shower, you go do this, you go do that, and you sleep. You should have a specific bedtime routine and you stick to it. Yes.
Thank you so much. Thank you so much. Welcome. It was very, very, very nice and interactive session. I really appreciate your time, and I appreciate you too for coming.
Thank you very much.
To you back at home, ladies and gentlemen, as you've been told, always have a sleeping routine. It will really help you to avoid yourself from getting other chronic and other psychological diseases. My name is Kasim Mustafa. Until next time, Masalam.